$8 million funding boost to encourage more employers to report on gender equity in the workplace. Jessica Rowe, SBS World News.
Voters in Fiji's general election will have their say tomorrow after months of campaigning. Healthcare has emerged as a major campaign issue in the country, where underfunding of services and general awareness remains an issue.
A vital conversation in a rural village, one Marioni Tanganadavui hopes could save lives.
Also, as I stand here today, I stand here with one breast. If I'm going to be very specific, I've got a bare chest because what I have on here is what we call a prosthesis.
A breast cancer survivor, the 57-year-old travels across the island, sharing her scars and knowledge with other women.
You raise the other one with your 3 fingers, and this is how you do your breast self-examination. In Fiji right now, for a stage 3, they could still survive. Hopefully they could survive 5 years. Right now, not a lot of women survive the 5 years.
Breast cancer is the most common cancer in Fiji, but patients have to travel overseas for radiation treatment. The country has the 8th highest death rate from breast cancer in the world. Ms. Taganadavui and the Fiji Cancer Society want to challenge misconceptions that lead to more than 50% of women not seeking further medical treatment after diagnosis.
Yeah, when they return to the hospital with their breast fungating, I tell you, it's not a pretty sight with a stench.
Many women opt for alternative medicines and even massages instead. A lack of awareness isn't the only challenge Fiji's healthcare system is facing. GPs say many recent medical graduates seek work overseas due to underfunding of the system here. Dr. Kripali Tapu was one such student.
Everyone wants to move to greener pastures. You want to do further training, and a lot of that wasn't available in Fiji.
After working in Australia, the Fiji-born general practitioner has bucked the trend and moved back.
I feel privileged that, I've had the opportunity to work in a developed country and to see what's gold standard and what's the best health care.
She's now the director of a free medical health clinic that's trying to ease the strain on overcrowded public hospitals.
In here, very good. First class, I say good, nice.
Prime Minister Frank Bainimarama's Fiji First Party is promising to train more doctors and extend hospital opening hours. The issue also on the minds of rival Sadelpa Party supporters.
The queue and even the system, it's very, very slow in Fiji.
Voters today waiting outside the election office instead, ensuring their paperwork is in order to have their say tomorrow. In Suva, Hannah Sinclair, SBS World News.
43 journalists have been